The consumer analytics team provides quantitative market intelligence that guides strategic business decisions. We explain market trends, predict how consumers will react to innovations, and recommend strategies for thriving in a changing business environment. We welcome any direct comments at jennifer.kent@parksassociates.com. Retailers, service providers, and device manufacturers are expanding the market of technology solutions that help seniors live safely and well in their homes. Our new research, Senior Living Technology for Safety and Independence, analyzes the existing and anticipated independent living needs among people ages 65 and older, as well as their family caregivers. It explores seniors' use of technology, attitudes towards and use of PERS and telehealth solutions, and tests interest and likelihood to buy selected solutions and services, including those enabled by smart home technologies and products. Key questions addressed include the following. What is the market size and characteristics for family caregiving solutions? What are the drivers and barriers of solution adoption? Which channels do consumers most prefer acquiring solutions from? What features and functionalities do family caregivers look for in solutions? How does the independent seniors market differ from the family caregiver market? How are seniors approaching the telehealth and connected health device markets? Our analysts are constantly studying this market and provide regular updates on the consumer healthcare market, including service features, key service differentiators, device adoption, pricing and business models, updates on existing players, and the impact on the caregiver market. To subscribe or request more information, please contact us at sales@parksassociates.com. Good afternoon, everyone, and welcome to Parks Associates Connected Health Summit. The topic of today is connected health innovation, devices, and services, where we will be taking a look at how consumerization and data sharing are changing the health device landscape. If you haven't met me before, I'm Kristen Hannock, one of Parks Associates research directors. I lead our coverage of the connected health market, as well as a few other verticals. In terms of the agenda for today, I'm going to be kicking things off with a brief presentation on some of Parks Associates' consumer survey data and findings on the market. Afterwards, we will be going into our panel discussion on the topic of new opportunities for sharing connected health device data generated by consumers. At 3 p.m., we will be hearing from Tony Dorman, founder and CEO of Electronic Caregiver, for our Visionary Spotlight. Afterwards, we're going to be going into our next interactive panel on the subject of consumerization in healthcare. Before we get started, I'd like to give a special thank you to our sponsors, Alarm.com, the Connectivity Standards Alliance, Electronic Caregiver, and Rapid Response Monitoring. And also our great speakers for helping to make this event possible, as well as our supporters. So yes, over the past few years, we have seen a lot of changes when it comes to connected health and health at home. What is health at home, you might ask? Taken on its face, we can define it as the products and services that help consumers to maintain or improve their health and well-being in the comfort and safety of their own home. We can separate health at home out into four major buckets or categories, looking at senior living and independent living, environmental quality and safety, home healthcare, and at-home fitness and wellness. The past few years have seen a great deal of interest and adoption of new products and services across all of these buckets. However, the most radical change has been the change that we've seen in home healthcare. Driven by the COVID-19 pandemic and resulting changes among regulators, care providers, and consumers, home healthcare has gone mainstream. Roughly 2 out of 3 US internet households are now familiar with telehealth services, and as of 2022, over half reported using a telehealth service in the past 12 months. This includes video visits, audio-only visits, and chat or text message services. This dramatic and exponential increase in adoption happened for several reasons. Many people were more or less forced into it. If care providers wanted to reach their patients, and if patients wanted to reach their doctors, they needed to use telehealth. Many people also found during that time that it was highly convenient. It had staying power. You could get medical care, including receiving a prescription, in minutes instead of waiting days for an appointment and hours at a clinic or other location. And with regulatory changes, the scope of telehealth widened dramatically to include not just minor acute conditions, but also chronic health, therapy, and many others. However, we've also begun seeing the limitations of what a telehealth visit can do. A care provider can hear the patient's self-described symptoms, look at obvious visual signs with a camera, but lacks the biometric data that would normally be easy to capture during an in-person visit. In fact, according to Parks Associates consumer surveys, approximately half of patients want to be able to share their connected health device data during a televisit. One of the reasons why patients are so interested in sharing this data is because they're already very familiar with connected health devices as a category, and with what these devices can potentially do. Over half of US internet households report owning and using connected health products, with the top devices being smartwatches and other wearables, connected weight scales, and blood pressure cuffs. In addition to reporting that they want to share data during telehealth visits, a large percentage also want to be able to share data with their regular care providers. Almost 40% of US internet households report that they are more likely to select a care provider if that care provider allows them to share health data generated from a device or app. In addition to patients wanting these capabilities for themselves, we're also seeing that family caregivers, mainly adults who care for an elderly loved one, want to be able to remotely monitor the vital signs of their loved one to have this data be involved in online medical appointments. This is especially useful for family caregivers who might care for an elderly loved one out of state or somebody who is geographically far away. So certainly quite a few challenges involved there. Data sharing has more or less become the missing link in virtual care. However, there are many questions that remain in this area. So far, care providers, clinicians, and others are looking to models where they may purchase and send out a kit of devices and have this be available to the patient. This is already widely used for remote patient monitoring, as well as remote diagnostics. However, there's also a growing number of devices that consumers have at home, such as the smartwatches with heart rate and rhythm data, smart thermometers, connected blood pressure cuffs, weight scales, glucometers, and many other medical devices. How can care providers make use of that data? Or should they? There is, after all, a great number of use cases and benefits for patients to engage directly with their own health data. And finally, when we look beyond into the details of how to make data sharing work, there are still many questions. What is the right way to integrate device data into the care process? If we include personal health devices, what becomes the source of truth? Is it the consumer grade product that might not necessarily be FDA cleared or medical grade? Or do we prefer the data that is generated during an in-person visit? How does that work? As well as, there are other questions too around data privacy and security. How do we keep personal health data private and secure, but also make sure it is shareable when needed and available on demand to the patient? Do we need to see patient data in real time, or is that actually not what we want? When does intermittent data actually serve all stakeholders better? When it comes to collecting data, what is the best device and method? And do we see that a kit of best-of-breed single-purpose devices is the best implementation, or do we really want a multifunctional device such as a smartwatch? To answer some of these questions and more, we have a really great lineup of panelists today that I'm looking forward to speaking with. This includes Shay Gregg of Fall Call Solutions, Drew Schiller of Lytic, and Craig Smith of eBuyNow. So Shay, thank you for joining us, and very much looking forward to hear kind of what it is that you do and a little bit about your company.
Thank you for having me today. Very honored to be here.
Very, very happy to have you with us. Can you tell us, I guess, maybe in the next minute or so, a little bit about yourself, kind of a founder and president of Fall Call Solutions, and a little bit about what the company does?
Absolutely. So again, thank you to Parks Associates for having me. And I'm a practicing trauma surgeon. I've been in practice for about 15 years. And what that has afforded me is the ability to really try to understand issues that people are dealing with in the trauma bay. And therefore, I'm very focused, and sort of my research interests and clinical interests have been around older adult falls and the caregiver engagement around that incident, as well as post-acute care. What's the safest way out of the hospital? What's the safest way into basically returning to function? So that's sort of my clinical world. And that led me to my entrepreneurial venture, which is Fall Call Solutions, which was established back in 2015 because I was really inspired by the smartwatch movement. And I asked the question, given that, that several people that I saw in the trauma bay, they had real reservations about traditional personal emergency response systems. So with smartwatches coming on the market, I was really excited about the prospect of building something that would call for help with a third-party and central monitoring service, but also offer all the technology associated with that smartwatch, the multi-stack device, as in heart rate data, now oxygenation data on Apple Watch, and still have access to the accelerometer. So after going to the lab, having that funding, raising that funding, we built a smart fall algorithm, which actually can distinguish between high and low falls and actually do tiered calls to either caregivers only for low falls versus high falls. We contact the central monitor system. Additionally, there's voice activation as well as manual activation for these calls for help. So Fall Call has since actually expanded globally. We're launching in Australia actually within the month. Through our partner HSCTG, and integrating into their Talius product, which brings AI and brings some of this data all together to sort of understand these complex bits of RPM that's out there, and then it's actually distributed to 28 different call centers, depending on the consumer. But I think we are on the verge of a real evolution in emergency response, and I'm very excited to be part of it on the clinical front lines as well as from the tech front lines as well.
Yeah, very, very happy to hear about that, and thank you so much for joining us. So next we have Drew Schiller, CEO of Lytic. Drew, can you tell us a little bit about yourself and about Lytic?
Yeah, absolutely. Thanks. Really happy to be here. So I'm the CEO of Lytic. Lytic is the leader in connecting personal health data with healthcare organizations. And so we launched our solution about 10 years ago with a digital health platform to bring all of the health IoT in-home monitoring data that people capture in their daily lives, everything from blood pressure monitors, glucose meters, pulse oximeters, thermometers, wearables, CGM, health apps on the phone, like you name it, we capture data from it. And we bring the data into the clinical workflow so that clinical teams can deploy remote care programs in their EHR, effectively making these personal health data a first-class citizen of the EHR. And so when I say first-class citizen, what I mean by that is in the same way that a healthcare provider is in the patient's chart and they order a lab, and then the sample gets sent to the lab for processing. The results get sent back to the provider in, via secure message in the Epic in basket or Cerner Message Center, et cetera. the healthcare provider reviews the labs and they type notes into the patient's chart about what they're seeing, and then they can talk to the patient, have a conversation about that, and further document that conversation. We enable that same workflow that providers are used to every day with personal health data. So you can a healthcare provider, whether it's a physician or nurse care manager, NP, et cetera, can enroll a patient in a program from inside the patient's chart in Epic or Cerner, et cetera. The patient completes the enrollment on their end. And then once they've completed the enrollment, they take readings, respond to surveys, et cetera, as they would in these remote care programs. And then anything that's clinically actionable as determined by the clinician, those clinically actionable notifications actually get surfaced up in the in-basket or via in-basket pools, so that a team of nurse care managers can help oversee a population. So it's in the workflow. And then we also visualize the data in the workflow, so that it's a very simple to use solution for the providers and doesn't disrupt how they typically deliver care. So we've had over 18 million people connected through our system over the last decade or so. We have millions of people connected every day. We run the largest remote monitoring program in the United States with Kaiser Permanente, which I'd be happy to talk more about and share more information about that. But there's been over 300,000 people and over 7,000 enrolling clinicians in that program. So some really successful stuff. And it's really because we're able to bring all of the data that you mentioned, Kristen, from all those in-home monitoring devices into the clinical workflow where clinicians can just make it part of their daily practice.
So certainly a lot of very interesting insights. These programs operating at scale and really trying to figure out kind of what the best practices are.
Absolutely.
Yeah, so very eager to hear more. All right, and next we have Craig Smith, the CEO of eBuyNow. Craig, can you tell us a little bit about yourself and about your company?
Hi, thanks, Kristen, for having me on the show. And my name is Craig Smith, CEO of eBuyNow. We are the global licensee for Motorola wearables. Our focus really is on the consumer area, really to get wearables, mostly smartwatches, into families' hands. Where we see the market developing is having a range of wearables, not just for you for an active lifestyle, but also for your parents, your kids. That you can start utilizing the data to see how things are changing throughout your family. We do have things like fall detection, heart rate monitoring, SpO2, sleep detection, daily updates. And where we see the market from a consumer level is to be able to give consumers basically the ability to see what is changing with my dad, how's his sleep going, having the protection of fall detection, obviously, but it's more of a long-term, are things changing his life with new medication? Is he still getting the same sleep? Is his metrics the same as other people within his age group? Because there's also the confidence side of things, not just the negative of somebody having a heart issue or falling. It's also like, my dad lives on the other side of the country, or my mum lives, somewhere that I can't get to very quickly. So can I see her metrics in a way that I'm comfortable with? So we're very consumer focused, obviously the Motorola brand and the channels that we're in. So we have a range of watches, 8 of them this year, Bluetooth and Wi-Fi, very much around the home ecosystem and sharing that data. And I'm looking forward to getting into how we do that later on.
Yeah, very much looking forward to hearing that as well. And thank you so much for joining us today.
Thank you.
So yes, let's dive right into our panel discussion. So really taking a look at what is the state of data sharing right now. So my question for you, and Craig, let's start off with you maybe. So where do you see the state of data sharing right now in terms of care providers and maybe other folks leveraging data generated in homes? What sorts of devices and solutions are consumers adopting, do you see?
I think we have to look at the dominant play, which is smartwatches right now. It's always on. It's always on your wrist. You sleep with it now, which is a big proponent in getting 24-hour. The battery life of smartwatches is now generally around 14 days for an RTOS product. So I think where we are today, the sensors certainly are coming to a certain level of trustworthiness. I'm going to stay away from FDA-approved areas and medical-grade devices. I'm really in the consumer world where we're trying to give people good information about how life's changing. But I personally think that where the market is right now is right on the cusp of having numerous devices on people's wrists, mostly smartwatches, and then open APIs where companies can start pulling data from other devices that they might need some corresponding data with, and then providing them to companies out there that are using them in the algorithms. We're very lucky to work with companies like LiveQ, BellPal, Now Performance. But if you take LiveQ, for instance, fantastic company who takes the data from our watches. I know they work with many partners, and they have some very powerful algorithms running that can start to do predictive analytics of whether or not you have COVID, for instance, or how your sleep is compared to when you started taking new medication. So I personally think on the data sharing side, as the market evolves, open APIs will be the future. And it will be, if you serve quality data, people will come and use it. If you don't serve quality data, you'll be left behind. So I think the market will even itself out in that way. The quality will dictate whether or not you will continue to be a part of the ecosystem. And if you serve up poor data, people will not use your product. That's our feeling.
Yes, and certainly some question there as well about data standards and making sure that the data from different devices actually has the same sorts of implications. Drew, I know this is a topic that you're also very, very familiar with, looking at what sort of devices are actually being integrated on your platform. Do you have an opinion to share here as well?
Yeah, I mean, we connect with, we try to connect with anything and everything. So we certainly see a very broad spectrum between, what is readily available through open APIs and what's available through closed APIs as well. I'll say a couple of things. One is there are some really strong initiatives to drive interoperability in this space, and I think that the number one thing that's going to really drive it is consumer demand for having these data actually used by healthcare providers. I think that that's going to really, once there is consumer demand for the data to be shared, I think that companies will have to respond. I'll say from a sensor perspective, I'll kind of share two conflating thoughts. The first is I am really excited by the increased capabilities of sensors that are available on wearables, both on the wrist as well as continuous sticker patches, things like that, maybe for populations who wouldn't necessarily be able to support something on the wrist. But also, I'm really interested in technologies that are developing to use the cameras on the phone. So the sensors that are available on a smartphone to scan your face and detect things like temperature and heart rate and things like that. And the technology is relatively nascent. There's some good, solid technologies out there that are okay for some wellness applications. There's some big barriers to overcome, as there are with any sensors, just around being able to support various skin tones and lighting conditions and things like that. But the reason why I like the concept of being able to use the camera on folks' phones is that if we can nail that, it drops the barrier of having a diagnostic device from somebody who can afford, a $200 plus wearable device, down to somebody who has a cell phone, which is the majority of the population, at least in the United States. And so I'm really excited by that capability. And the implications there could be that now healthcare providers could be able to service, populations who are historically sort of underserved by technology in healthcare much more readily. So I'm really encouraged by that capability, but it's still a future state.
Mm-hmm. And then Shay, so you're coming in from a little bit of a different perspective, a little bit more on the medical side of things. Where do you see, I'd say, kind of the state of data sharing right now? Kind of where are maybe care providers leveraging data? Where are maybe consumers?
Sure. So I think what really sort of opened the door to data sharing, and actually, Drew's in the middle of this, and I'm sure that Craig is too, is the Cures Act, where the medical records all of a sudden are now available to the user, actually the person who has who's been in the hospital recently or is actually getting their labs tested. and also their caregivers, the family members as well. They do share this, and actually, this is where, at least in the hospital setting, I'll get to home in a moment, but in the hospital setting, I can tell you there's multiple times where family members know data. Sometimes before practitioners do, and they ask questions about, oh, what does that MRI show, or what does the ultrasound mean, et cetera. And then actually, they say, well, there's this duct, and what is this? If it's too big, what does that mean? So it's actually by having that almost nearly instantaneous access to that data, I think it actually has enriched conversations. And also looking at the medical record and sharing the notes and et cetera. So I'm actually a big proponent of transparency in medical care. I will be the first one to be at the bedside as I'm teaching the next generation that to share a medical record with family members, so long as the person is amenable to that, that we're looking at together. But I think it really adds context and some background and sort of allows you to build up a care team. So the specific things that I see are phones and tablet devices, and we're a member of AARP Innovation Labs, and we collaborate with them. And the latest tech survey shows that older adults are using them, and their caregivers, there's increased uptake. So from a data sharing standpoint, I think the Cures Act really opened up a lot as far as getting access to data. As far as being, an entrepreneur and dealing with, the aspect of the fall call and seeing the growth that we're seeing tremendously, there is a huge cry for some classic devices, especially in the personal emergency response space, to have that connectivity to mobile devices, cellular devices, Bluetooth devices, Wi-Fi related devices. The models are changing in front of us. And I cannot tell you now how many times I go to the trauma bay. The traditional call is over the age of 65 fall with head strike on anticoagulation. Had a couple today. And they have smartwatches on, pick a smartwatch, the most popular being Apple Watch. But you see Galaxies out there, you see smartwatches that are out there. So, and they're becoming more and more diverse as far as the offerings out there. So, I'm encouraged by that. And I'm encouraged by some of my colleagues that are on this panel that are actually able to connect with those devices. And I'm interested to see where, my colleagues in the clinical world how we'll be able to sort of manage that data, understand that data, respond to that data, because it's going to need to be packaged in such a way that really, I think these innovators that are with me, so we can actually have, take action in such a way that will truly be meaningful for families and or for patients.
And you raise actually a really great point. So I know in our consumer survey data here at Parks, we're seeing that quite a few consumers and patients say that they want to be able to share this data generated at home from their own devices. One of the factors we've seen kind of come up more and more is that a lot of these devices are not necessarily medical grade products. The data might not necessarily be standardized. For some of the kind of solutions that sit on top and make sense of the data, they might have been trained using one specific device that has maybe some different implications than using a device from another brand or even another model. Drew, since I know you guys work a lot with lots of different products, lots of different companies, what are some of the opportunities and challenges that might come along with this plethora of devices out there?
Yeah, absolutely. Yeah, thanks for that. And just to build off what Shay was saying, I think there's two angles to this, right? So the first is how do we bring this into clinical workflows so that clinicians can actually use the data in a helpful, so it's helpful to their practice of medicine as opposed to distracting and burdensome. And then second, how do we actually make sure that consumers are getting the care that they need with the data that they're already capturing? And what we're really seeing is two things here that come together very well to form a good program. One is on the clinician side, the data needs to be accessible in the workflow where they're already spending their time. And it's such a really critical component, because when we were talking before we were building our solution that integrates into the workflow, we were talking with clinicians. They said, we have digital health tools. We can get, programs with portals that we can log into from many devices out there. But at the end of the day, at the end of a work day, are we going to go, log into some disparate system and check in on patients we haven't heard from? Or are we going to spend the time in the clinical workflow, tidying up clinic notes for the patients that we did see, right? That's definitely where they're going to spend their time. And so, so we felt that it was really important to build a solution that integrates into the clinical workflow, and more importantly than just integrates, elevates the exception data from what's happening in people's daily lives. So when there's something clinically actionable, the clinician then knows that that's something that they need to look at, right? In the same way, to Shay's point, that when a clinician knows that there's an MRI, the family caregiver and the patient also know that there's an MRI, right? And so in the same way that when there's an elevated reading, like, they know that, and it's important for the clinician to also be alerted that this is something that they could have a discussion around as well, and maybe triggers a telehealth call or a follow-up visit, as it may be. And from the other side of it is that when the patient is enrolled in a program, it's really important that that the healthcare provider, whether it's the physician or the nurse or an NP, et cetera, when they enroll the patient in the program, they talk the patient through, here are the goals of the program. Here's why you're a candidate. Here's why we think you'd be successful in the program. Are you on board with this plan? And it's important for the patient to say, yes, I am on board with this. And I understand if I don't take my readings, you're going to know that I don't take my readings, and you could call me and tell me to remind me. The system's going to remind me. And so they're kind of in it. There's like a commitment device. And so, for the last 20, 30 years, the standard of care for many, many conditions, diabetes, hypertension, et cetera, has been a provider telling a patient to use a device in the home, take their blood pressure reading daily, write it down in a logbook, et cetera. And that should help manage blood pressure. And it hasn't really. It kind of works for some patients, but not for most. But it's really successful with these remote patient monitoring programs when the provider and the patient are both sort of in it. And the reason is because there's a commitment device there. The patient knows their role, the provider knows their role, and they're in it together, sharing data for the purpose of improving medication adherence and driving better long-term patient outcomes.
And certainly having that type of active collaboration and kind of meaningful purpose in what you're doing certainly helps drive the point home and keep their minds on track. Craig, I know you mentioned having kind of a little bit of a different take. So you're seeing things more on the consumer side. I guess kind of what are some of your thoughts about working with the medical side, or is that just for lots of companies maybe not a factor that they're looking at?
Look, I see it in a way that I think that Shay and Drew have a very targeted endpoint to clinician care, and that's where the industry will eventually be to be predictive. Where we are from a consumer level, we're looking at aggregation of data. So we're trying to say, look, if 2 million people are wearing smartwatches and we're measuring their pulse, we know their age, we know their weight, we know their height, their demographic. We can start giving some really basic data that is very useful. Is your sleep normal for your age? Is your sleep normal for your dad's age? How are you in your demographic? So where we are from a consumer level is aggregation of data, making sure the sensors are providing realistic measurements between devices, because sleep from one device from another could be dramatically different. Heart rate monitoring could be dramatically different. So creating a level playing field on that is very important. But getting aggregated data, pushing that out to people who can do some very clever things to it, the companies I mentioned earlier, like BellPals and LifeQ, then allows those companies to take it forward and start looking at things like, is there early onset Alzheimer's, dementia, Parkinson's? That's what BellPal's working on with full detection. And as I said before, with LifeQ, they're working on a whole set of algorithms around bioage, stress, and sleep analytics, which they then pass on to clinicians. So where we in the consumer industry are, and we're looking at really three facets. Facet one is, how are you as an individual? How, your own personal data and what you do with that. Two, does your data look on from an aggregate level? So how do you compare yourself to people maybe at your gym? We call them circles in Motorola, but people maybe at your gym, people maybe in your family. How do you compare with people of your age? And 3, how do I share my data to people who are relevant? And on a consumer level, the very easy one to say is, my dad's 88 years old. He lives alone in the UK. I don't live in the UK, and I just want to make sure he's sleeping okay. He hasn't fallen over. His heart is okay, etc. So it's that sharing of data, relevant data to the family group, or maybe even next to the clinician group, which is becoming very important. So from our side, we're below the clinician side, but we do feel it's very important to aggregate that data, share it in a way that's responsible, either with the family group, with your circle, or with yourself, and make sure that's a standardized platform, which is something that Drew is obviously very, very well ahead of, and he'll know the different metrics that come into him. You probably have to do all kinds of work, Drew, to align them.
Yeah, we do. It's quite a lot. Yeah.
So yes, one of the questions Parks Associates has asked over the past few years to audience members at these different conference events is, what is the biggest challenge of applying data to improve care practices? We're actually asking it to the audience right now. So audience members, please go click onto the right of your screen to answer the polling question. So every time we ask these questions, we get a lot of folks saying that data in different healthcare silos really continues to be a big problem for lots of folks. Shay, you mentioned kind of the CARES Act and trying to make medical records more accessible. And of course, there are all these different types of interoperability initiatives, but it seems like lots of folks are still running into healthcare data silos as a big challenge. So what would you say is kind of the state of siloing today from an actual medical practitioner side? And are you seeing that patients are actually able to increasingly own their health records, get access to it?
Sure. So I think, it started again with the Affordable Care Act, where meaningful use came out, right? So here we have companies that basically ran to create medical records, and the big ones right now are Epic and Cerner, pretty much as far as significant, medical records. Then you have Meditech and a variety of other medical records that fill out the rest along. And I know that, Drew's nodding. He definitely knows these. Yeah. And we all know these too, because these are parts of our lives. But so here we have, electronic health records. I find it fascinating that here we have major companies that have actually developed this technology, yet the interoperability amongst the medical health records is not there necessarily. So as far as getting a Cerner record over to, whether it's radiographic data, whether it's vitals data, whether it's you're doing interfacility transfers. As a trauma surgeon, we take transfers all over, the region. And we want to get radiology that was performed at a different facility, and that actually requires a cloud instance, and then sharing that. Where in some places are still stuck with CDs that they're sending over, and you're good luck finding a CD player in a hospital nowadays just to get radiology. So it's very interesting how electronic health records have siloing themselves. And it has been sort of left up to the private sector to be creative, to actually find ways to make these things interoperable. So I think data in my day-to-day practice, data siloing is a reality. And how to overcome it, I think it is going to take the creativity of innovation in the private sectors, and also regulations as well. As an example, you have companies that are on this meeting now that are, I'm sure, both as panelists and also watching this, that they're trying to think of ways to make Cerner talk to Epic, and how to sort of interconnect all that data, bring it to a warehouse, and make it deliverable and understandable. But it's also a matter of as far as a regulatory standpoint, where there are regulations that are coming out, say for verification of trauma centers, where There's an expectation where you will have access to cloud-based radiology technology or radiology sharing in order to take care of patients. That continuity has to be, seamless, and it has to be there. Yes, siloing still exists. I think we are likely years away from truly overcoming it. And I can tell you as a clinician, I look forward to those days where it is going to be a click. You should never click more than 3 things in order to get access to something, right? Mm-hmm. I really hope that we can come together as a community, and the creativity continues, and it will make it easier for us to, 1, understand and respect the quality of the data, 2, know what to do with the data eventually when it receives when we get it, and then 3, have actionable, meaningful interventions on that data once we do understand it. So the algorithmic management of it. So that, that's where I think we still have a ways to go, and I'm encouraged by what I see on a daily basis, and it comes out, but we need to get there. We do need to get there.
Yes, I remember a number of years ago, there were initiatives at personal health records, so records that would be tied to an individual patient, sort of irrespective of which care provider they were going to or which EMR was being used. And that, of course, kind of fell on its face for various reasons, but it might be interesting to see if that makes a reappearance in the next 5 to 10 years. Yeah, I guess kind of another question for me. So we have seen kind of over the past few years with the rise of virtual care, and kind of the COVID-19 pandemic, that there has been this massive boom, of course, of health device adoption, interest in using health devices, interest in new kind of virtual care modalities and technologies. A lot of that seemed like it was contingent on the COVID-19 state of public health emergency. So my question, and maybe this is to Drew, what happens when that goes away? Do you expect to see kind of a continued interest in these, or are there maybe regulatory changes or waning interest that might be on the horizon?
Yeah, absolutely. Well, I think that the cat is out of the bag, so to speak, on virtual care. Like, it is going to be here to stay in some way, shape, or form, and I think that that's driven by both consumer demand from people, patients, if you will, who are now expecting to be able to see a doctor virtually or speak with them over the phone in addition to in person, as well as, frankly, clinicians. Like, there are many clinicians now who prefer to have at least some portion of their visits be virtual when they can't be. And I think it's really important to note that healthcare has a workforce crisis where we need to be able to engage healthcare workers and keep them motivated and happy. And, they're already overloaded, and there's a lot we can do to help streamline their efforts. But I think a big part of it too is job satisfaction. I think virtual care plays a big role in that. And then relative to specifically, you're asking about the COVID-19 provisions in the public health emergency. There was just at the end of 2022 in the omnibus bill that passed right before the holidays, there was a 2-year extension to the telehealth codes and telehealth billing, I should say. We expect that will likely continue. That has support from both sides of the aisle, so to speak, in Congress. So I do think that we'll continue to see strong telehealth reimbursement in the future, and I think that there will be some evolution. But I think that there will be dollars there, and more importantly, the experience is there. So in the same way that most of our companies have gone fully virtual or hybrid, most companies, unless there's a requirement due to warehouse facilities, manufacturing facilities, et cetera, most companies that have desk workers are in some sort of hybrid environment. I expect we'll continue to see the same for healthcare systems, where there's more of a hybrid environment, and we can have more virtual check-ins with patients going forward.
Mm-hmm. So certainly all sorts of benefits there in terms of job satisfaction with workers, just improving overall efficiency, and improving kind of clinical outcomes.
Yeah, and I'll also add that these data, like that we're talking about, that Craig's talking about, and the devices that Shay was mentioning, where there's in-home monitoring devices that people use, and we, as I mentioned at the top, we bring them into the clinical workflow. They actually, like, I know that we talk a lot about billing and all this, but they do improve workforce efficiency. Like in our programs, we see that 9 out of 10 clinicians say that that having patients enrolled in these programs saves them time, because they have accurate, timely data in the EHR, and so they know which patients to pay attention to. They know which patients to have to call and have a conversation with versus which ones they need to bring in for an appointment. And then we actually seen there's a decrease in the amount of time that clinicians spend on the phone with people who are in the program, from 15 minutes down to 5.5 minutes on average, because they could just jump right into the meat of the conversation. They didn't have to spend time saying, have you been taking your readings? Can you tell me what your readings are for the last couple of weeks? And all of that, right? They could just jump right into like, okay, cool. So we see you've been taking your readings. We understand there's some challenges here. Let's talk about that. So, so there's a big workforce efficiency play with these data when it's deployed properly in the clinical workflow.
And certainly, as we've all seen over the past few years, the medical sector is increasingly overburdened.
Yeah.
Yeah, so I guess I should mention, audience members, we are going to be having a few minutes at the end for questions. So if you have any questions for our panelists, please make sure to get them in now. Before we head into that, though, I have another question for you all. So we've seen over the past few years a lot of momentum really generating a lot of new interest. What do you see as maybe being necessary to drive this market forward? Kind of really using health device data to empower patient care. And Craig, maybe you can kick us off here. Or maybe not patient care, but improving people's health and well-being.
I think it resonates quite well with the last question, really. Like, have we reached a watershed? And I think COVID really was a watershed. We ship watches to 71 countries around the world, so we're a little bit more global in our thinking. We have some very big epicenters in Argentina, Brazil, Eastern Europe, Southeast Asia, and I think with COVID we realized that that there are global things that happen, and global information is important to people. So smartwatches are here to stay, or monitoring devices are here to stay. We know the TAM of the industry is between $24 and $27 billion, with a 12% growth per year. This is these are heady days for this industry, so that it's not going away. And I think thirst for knowledge is getting higher and higher. We're all looking for things like glucose monitoring from a wearable device, etc. And I'm sure that'll be on the roadmap somewhere. And people are aware of that. So anyone who uses a device today, and Apple's done a fantastic job creating awareness in the market. Fitbit did a fantastic job with creating awareness around 10,000 steps. And I think these have become such adopted in our culture and our nature that everybody knows what a 10,000 step is. People know 8 hours sleep a night. That these things aren't going away, and the thirst for knowledge is now at a point that if we can start showing people comparison data, if we can start showing people family data, is your mum and dad okay? Is your kids getting enough sleep and steps in? I think it will just drive higher and higher adoption. So for us, the future of the market really is around how we share our data. That's very important. And for us, if we can start to align through where we as companies share the data, who's picking that up, running it through their algorithms, and then sharing that with clinicians or with the general public, etc. I think they're very important companies in this ecosystem. What Drew's doing is vitally important in the ecosystem, because it takes devices on people's arms or on people's bodies to feed that information in that someone like Shay can use to make better judgments. So for me, the market has reached a place now where it's not going away. It's going to get stronger and stronger. And there are good days ahead for people's health, and for early warnings, that's for sure.
Yeah, lots of potential movement there. So really taking a look at what all the data can do.
And
Shay,
actually,
can you?
yeah, I want to comment on this because, there you have the office-based physicians, you have hospital-based physicians, you have and care practitioners, APPs or godsends, APRNs, people who really sort of participate in the care process. I think actually, Drew, I think you mentioned something about purpose-driven, care, and one thing that really I think is going to be sort of valuable, especially to the different specialties. There is diagnoses that basically will have equipment that is very useful to sort of make decisions, actionable decisions around it. So if you have CHF, maybe hypertension or blood pressure is going to be very important. Heart rate might be very important. Weight will be very important. Let's say I need to make a diagnosis of a postoperative wound infection. Well, telehealth associated with cameras, real-time cameras or evaluations with that. Let's say I need to make a diagnosis of diabetes. Well, real-time glucometers that actually can transmit data. I think that as we enroll our patients into these programs, if we can focus in on, COPD, CHF, post-operative, post-acute care, post-surgery, glucose-related things, I think that it will reduce the overwhelming aspects of all this equipment that is being integrated in a home. So it's really sort of focused on managing these, especially these, very popular readmission diagnoses at home. So it becomes less overwhelming, especially if we, make these seamless interfaces between the mobile devices or, the tablet-based devices, or it can come directly from a wearable. So it's really sort of naming the purpose, as part of the program. And from the clinician standpoint, it's overwhelming to get a bunch of, let's say, heart rate data, blood pressure data, glucose data, et cetera, when you have, without a sort of a focal clinical question. So I think it's going to be important, in what will sort of mark success of certain programs will be, okay, you have your major readmission diagnosis of CHF. Really, this is the equipment you need. This is what, and your clinician can really make actionable interventions based on that versus COPD versus diabetes, brittle diabetes that we see very frequently and contributes significantly to morbidity and mortality, or the post-op surgical patient, et cetera. That's where I love to see this go. Because, you see people in the office, 30 people a day sometimes, or, you're discharging all these patients. You want to make sure that there's really sort of a focus for them and a focus for the clinician. And I think you will see a lot better efficiency of care, and I think higher clinician happiness rates and better Press Ganey scores overall.
So really,
yeah. Shay, that's exactly right. And that's exactly what we see. And when I mentioned the program of care, where the clinician's enrolling a patient in the program and the patient knows what their role is, the clinician knows what their role is, that's exactly right. The biggest drivers for programs that we run are typically diabetes, hypertension, heart failure, COPD. Like, it's the exact use cases that you're identifying. And that's why, at Kaiser Permanente, we were able to have over 7,000 clinicians enrolling over 300,000 people in these programs. Their use cases are exactly that: diabetes, hypertension, heart failure. And the clinical results, when you have, it's a specific device for a specific condition, understanding the criteria, are outstanding, right? So for diabetic patients, within the first 90 days, the average A1C drops by more than a point. For diabetics who started with an A1C over 9, their average A1C dropped by more than 2 points in 90 days. And for hypertensive patients, within about 6 weeks, the average systolic blood pressure moves from stage 2 to normal range for that population. So, which in 6 weeks is pretty good. And so we're seeing really strong health outcomes in addition to, strong patient engagement and really great results from the clinicians. And it's because, to your point, Shay, it's all about that program of care. And, Kristen, to say, like, what do we need to do kind of to drive this forward? Man, I mean, I'm super excited about the future of all these sensors and all that. If we could actually just bring in the data from the devices that we've had on the market for the last 10 or 15 years, and just like like bring the data into the workflow in ways that clinicians can easily use them, that would move the industry forward light years, right? It would bring the industry forward to 2022 instead of where it is now back in like the 1990s.
Yeah, so seeing the application and the design side of things kind of make a big step.
That's right.
And certainly, I think we've seen that in lots of other fields as well. There's a great wealth of data being generated, all these kind of useful different applications you can run, but how are you going to integrate the data? What are you going to do? Has always been the big question. So we do have some questions in from the audience that we're going to have a few minutes to answer. The first question in is aimed at Shay. So our audience member saying, I noticed Fall Call recently announced a global launch. Given the very different healthcare environments in the different geographies, can Shay share any tips or learnings around this launch?
Well, I think that so putting on the entrepreneurial hat and actually just the clinical hat in general, we know that two things. One, we know that falls in particular are a global epidemic. Mortalities from falls continue to actually rise. Morbidity from falls continues to rise, despite the technology out there, despite fall prevention programs, and just mortality and morbidity it continues to increase. So, and what I've learned obviously with this partnership is that it exists in Australia, it exists in the UK, it exists in Canada, it's all over the world. So that was, I think, an interesting, that was validating sort of what I am seeing on the front lines. But the other thing is, again, what we really are trying to do is, yes, we're trying to really make a personal emergency response accessible and affordable on the devices that people already own across the world. That's really sort of the vision for Fall Call. But also, we want to engage caregivers to a level that they have not been engaged before. With these personal emergency response devices. And I can tell you a pain point and a real problem. You are in the midst of a trauma, 5 trauma activations. You're in a busy trauma environment. And there are family members that won't find out for a long period of time that their loved one is sitting there receiving care at a local hospital. I think, again, as I mentioned sort of at the beginning of the presentation, transparency with medical records, sharing that information, and sort of finding creative ways to engage caregivers, family members, friends, whoever it might be, is going to be important moving forward. And I think that through this new partnership, we will have the opportunity to scale our vision and our mission. And as we move into Australia, in Japan, there's a described caregiver crisis. There's a caregiver crisis where they're, predicting like 0.5 caregivers or less to, people who are aging in place. We need, through design, protecting autonomy for obviously the older adult, but also engaging people in a way that is respectful, and designing systems that can provide interventions that are, I think, a lot quicker and more efficient, and to these urgent or emergent situations, or in the case of Craig's work, to give people heads up on if there is a problem with sleep, if there's a problem with, let's say, multiple episodes of trips to the bathroom at night, how can we basically intervene before there's a problem? So I think we're all working, and I would probably, share this sentiment, but between making things more affordable and accessible and engaging the caregiver is something we hope to basically scale, and what I've really learned, it exists across the world.
Mm-hmm. Certainly, they are these big universal challenges. So we have, I think, time for one last question from the audience, and we do have one. I think this is aimed at Drew. With the potential of overwhelming clinicians with data from a variety of devices sending in real time, please, I guess, comment on the use of dashboards and such.
Yeah, absolutely. So just understanding we're running close on time here, I'll be efficient with my words. What I always say is, if a physician's getting alerted too much, then they've set up the program wrong. and I'm not trying to put the onus unfairly on the clinician, it's more on the program design. The idea behind these programs should be that only clinically actionable alerts should be sent to a clinician. And that could be to a physician, it could be to an NP, it could be to a team of nurse care managers via message pooling. But when there are alerts sent based on the data, it should be something that the clinician is glad to receive. Anything that's like an FYI, it should not be delivered to a clinician via the message pool or via the direct message. That they are already inundated with enough messages. They already have too much to review. So that's actually not helpful. So I think first and foremost, setting up the program design to be where they're actually only going to be alerted when they need to be. And they're glad that they were alerted. And then in terms of dashboards, absolutely. So, I think that it's very important to be able to provide a population view to understand, hey, what's going on? Who are the folks in my population who are, at a population view managing their conditions okay, versus who are the ones that maybe had some non-clinical alerts but have been taking readings that are consistently outside of the bounds that I would have set for a goal for the program. And then you can start to work through a list if you have time to do that. You can start to work through a list and prioritize those reach outs, typically with a nurse. And those conversations can lead to billable clinical appointments, telehealth visits, things like that. But I think that it's really important to be able to provide that dashboard view of all of the population who's in the panel. And then finally, you want to be able to provide a patient-based dashboard with historic readings that are very, very easy to pick out what are the things that are concerning for that individual. So just showing like a digital logbook where it's like all the readings are there, you can kind of see if there's any red flags, but starting to draw arrows when something is reading too high, or starting to on a graph view call out when readings are above or below thresholds, and maybe identify if there are certain times a day when those readings are above those thresholds. Those are really important clinical conversation points that a clinician can have with the patient, and they can see at a moment's notice in a glance. And so there's a lot you can do with how you display the data to make it really, really efficient and usable for clinicians.
Yeah, so certainly making sure to
Thank you
send
for
the
that.
right to the. Oh. Yes, I'm sure you've seen a lot of that too, Shay, in kind of your professional work.
Indeed. I just want to thank you for that. Dashboards are something that greatly sort of enhances our efficiencies by having it at a glance. And I mean, it takes a simple walk through an ICU when you have monitor fatigue going off all over the place. And but if you go to that central dashboard and you have that, one thing that says you have to focus in on low saturations, it makes life a lot easier. So it's really, it's human engineering, it's clinician input, and we need to continue that collaboration across, the spectrum of industry and healthcare.
Absolutely.
Absolutely vital. I think we are at the top of the hour. Thank you all so very much for participating in this wonderful conversation. Very much appreciated.
Thanks,
Thank
everybody.
you very much. Thank you.
It was awesome.
Yeah, it was great having you all here. So next up we have our visionary spotlight, which we'll be going to in just a moment.
use of telehealth services has exploded in the past 18 months. Parks Associates' latest data shows that 64% of consumers used a telehealth service in 2021, up from only 15% in 2019. Beginning in 2020, telehealth and telemedicine solutions were thrust to the forefront of healthcare as a result of the COVID-19 pandemic. The need to avoid exposure to the virus has reversed well-established consumer preferences for in-person visits over remote care. Radical shifts in the regulatory and reimbursement landscape have paved the way for rapid telehealth deployments. Our new quantified consumer study, Virtual Care, Connected Health Devices and Services, provides trending data on 5,000 broadband household responses about familiarity, use, and demand for telehealth services and connected health devices. It evaluates user experience with these services and consumer demand for virtual care as a standard offering. For more information on this new research, please contact our team at sales@parksassociates.com.
The consumer analytics team provides quantitative market intelligence that guides strategic business decisions. We explain market trends, predict how consumers will react to innovations, and recommend strategies for thriving in a changing business environment. We welcome any direct comments at jennifer.kent@parksassociates.com. Retailers, service providers, and device manufacturers are expanding the market of technology solutions that help seniors live safely and well in their homes. Our new research, Senior Living Technology for Safety and Independence, analyzes the existing and anticipated independent living needs among people ages 65 and older, as well as their family caregivers. It explores seniors' use of technology, attitudes towards and use of PERS and telehealth solutions, and tests interest and likelihood to buy selected solutions and services, including those enabled by smart home technologies and products. Key questions addressed include the following. What is the market size and characteristics for family caregiving solutions? What are the drivers and barriers of solution adoption? Which channels do consumers most prefer acquiring solutions from? What features and functionalities do family caregivers look for in solutions? How does the independent seniors market differ from the family caregiver market? How are seniors approaching the telehealth and connected health device markets? Our analysts are constantly studying this market and provide regular updates on the consumer healthcare market, including service features, key service differentiators, device adoption, pricing and business models, updates on existing players, and the impact on the caregiver market. To subscribe or request more information, please contact us at sales@parksassociates.com.
Hi, everyone, and welcome back. Sorry for the delay there. Thanks for sticking with us. I'm Jennifer Kent, Vice President of Research at Parks Associates, and so pleased to introduce our visionary spotlight speaker. Tony Dorman is the founder and CEO of Electronic Caregiver, which is, he and his team are taking a really unique approach to virtual care, focusing on a virtual assistant approach and infrastructure as a service. So I'm very excited, Tony, to welcome you in and to hear a little bit more about Electronic Caregiver.
Hello. So we've had some logistical issues on our end today. Sorry about that. Thank you.
No worries.
How do you hear me?
So pleased that you could join us, and we sure can hear you. I can hear you and see you.
Okay, fantastic. This is a great time for the digital health industry. Electronic Caregiver has made some groundbreaking moves that I think are capturing a lot of attention right now. As we look back and mention how this is such an interesting time, we had walls of 10,000 patient files. And Bush came in 2004 and said, we've got to digitize. We have, missing paperwork. We have, illegible notes in patient files. And Obama swept in around 2008 and gave a deadline in 2014 to get the digitization of the health industry completed. And so what started to happen is, coinciding with that, we had widespread adoption of broadband and better connectivity, better affordability, better access. We had the same thing occurring in cellular. Now, when we first started to digitize, we had some trouble. We had doctors that were stuffing servers into back closets without an IT team. But as we were digitizing the industry, we had this widespread adoption and expansion of the cloud. And the cloud has changed everything. No more obsolescence, no more, weekly crashing servers with days of delays to get them back online. And only recently have we come to the federal mandate where we've structured and standardized interoperability between all of these systems, from clinics to hospitals to lab companies. So this is a time where all the infrastructure has been put in place. And one of the reasons it's such a great opportunity, and why I'm so happy we did it, we timed things really well, right? Healthcare moves very slow. Takes a long time for change to become adopted by hospitals and by clinicians. And so here we are with telemedicine, 300,000 mobile apps being dropped into the marketplace. And we've got the digitization, interoperability, the cloud, all the connectivity. And now we have these amazing new technologies. In our world, we did a lot of research. We put together a laboratory, and we took different types of apps and devices, and we deployed them and put them in front of thousands of patients, collaborating with hundreds of providers across 32 states. And we spent 6.5 years doing it, finding out, what do these patients respond to? What were the preferences for the providers, for the doctors? And what we offer as solutions in the market today is what we say is digital health that's evolved beyond just the app. And what I mean by that is, and by the way, I think we have a video queued up, which we'll be able to show. So I'll call for that in a minute. But when we look at the overall climate, we have 1 in 3 worldwide living with multiple chronic conditions. 1 in 3, 8 billion people on the planet, and 1 in 3 have multiple chronic conditions. In the United States, 133 million Americans are living with at least one chronic condition. And they say half of all treatment failures are attributed to patients not following through, and they're non-compliant with their treatment plan. They don't follow through with their care directives, and most of that's happening in the home. So it would be very important to be able to connect clinic to home and have greater insights and greater support behind these patients. That's a lot of patients. Now, we also have an aging population that's over 50 million, that's going to be at 96 million by 2060. And they require, increased care as they age. But we have a limited supply of doctors. People have been talking about this doctor shortage. Well, they're right now saying that in the next 11 years, we will be short on the high side 124,000 physicians. And on the nursing side, it's just as bad. We have a limited number of medical schools, a limited number of seats, and that, supply is fixed. So we're now experiencing a labor force in medicine where 33% of our doctors are 65 or older with an average retirement age of 68. they're working well beyond the intended, period of time, the period they intended to work. And so we're about to experience at a time where we have, this 1 in 3 worldwide with multiple chronic conditions, where over 40% of the US population has at least one chronic condition, the majority of them more than one, where 27% of our kids in America have a disability or a chronic condition or both. And we're about to suffer the biggest implosion to the labor force in medicine that we've ever experienced before. And so we have got to be able to use technology to help the providers in place deliver more services to more patients. And while we're at it, since we're, providing these new technologies and capabilities, there are a lot of other things that we can help resolve. If half of all treatment plans or half of all treatments fail because people don't comply with their treatment plan, that's something we can use technology to fix. So we can, subsidize the labor force. We can fill the gaps, and we can do things that we were never able to do before. For instance, the average patient is seen 4 times in a year. That's on average. Well, a lot happens over a calendar quarter, especially with people that are aging, people that have chronic conditions. And there have been different studies that show how much failure to report there is by older adults, by middle-aged adults, by younger adults. And in the chronic population, you'll have people that are showing up at the doctor's office, a lot of older adults, and they're embarrassed because they forgot to take medications or they forgot to follow through and record their vitals. And they're writing them down on an envelope and then carrying in fabricated data, which is not good. So there are a lot of symptoms and changes in health status that are happening, week to week or month to month as these quarters are passing. And a lot of it, by the time somebody sits in an exam room for, 40 minutes or an hour, and then spends another 25 to 30 minutes, from the waiting room into the exam room. So once they've had that long wait, the doctor rushes in, opens the file, and they'll say that maybe the doctor has 10 to 15 minutes that they spend with a patient. But the reality is when they're not noting something, stepping out of the exam room, it actually ends up being more like 6 or 7 minutes of actual face time. So they open up the file, they begin to ask questions, and the patient is thinking, for weeks, I have to remember to tell the doctor about this new symptom. And they forget. And the doctor's patient file is vacant of a lot of information, and some of the information they're getting is made up and inaccurate. So now imagine laying a pipeline at scale to your individual patients with a better interface of technology, collecting more data per day than we've ever been able to collect before, doing automated, interactive, highly engaging health assessments, being able to verify that the patient's being reminded to take key vitals, that they're following through on taking key vitals, and that those vitals are accurate, on reminding them and stepping through taking their medications, but being able to have verification that they actually are ingesting the medication and being able to look for evidence of overdosing, non-dosing, cheating, forgetting. So now all of a sudden what's happening is when we can regularly assess the patient, when we can get data from mental health surveys to biological, physiological, biometric data. Now what's happening is a doctor kind of gets this X-ray vision and can now look off and see on an individual basis how patients are responding to their treatment plan, but they can do it at scale. And what that requires is the right technology. It takes an intermediary telecare team who filters the data, who updates health notations, and then passes that through to the doctor. We were never able to put all of these pieces together before. And with the recent pandemic, after the convergence of the digitization of the health records, the EHRs, EMRs, people getting into the cloud, the connectivity of broadband and cellular, and better interfacing technology, we now have the ability to lay those pipes and measure on an individual basis how each patient is responding to their treatment directives. Now that empowers a doctor with the ability to fine tune that treatment plan with data they're receiving that's been validated in real time, so they can intervene earlier, they can intervene faster, and they can intervene more informed than ever before. And now we're talking about the true advent of precision medicine and personalized care on an individual basis, but deployed at managed scale. That is what, we've come to now, and it solves a lot of problems. It helps us extend our labor force to serve more people. It helps the care become continuous, and it gives us that data-rich experience where now we're actually improving outcomes, extending functional lifespan, saving lives, and dealing with some of the biggest challenges in healthcare. If you want to take a look at some of the technology, we've taken an integration of cloud and edge computing and visual analytics and mixed reality and Bluetooth connectivity to health peripherals, to RF wearables for different movement and different types of auto fall detectors and getting responders when there's a crisis. And we've mixed all of this into a virtual caregiver that has some amazing features. Are we able to play that video and show the Addison Care virtual caregiver?
Yeah, Tony, that's great. I was just going to say we have a few minutes left, so we wanted to make sure that we got a chance to go ahead and bring that video in. So we're going to do that now.
Yeah, let's take a look at that.
Hi, Sophie. You wanted me to remind you when it's time to take your medications.
Addison is a 3D virtual caregiver, and she's meant to assist people in the home. Her base functionality is to help you with your reminder schedules and checking your vitals and emergency response. But even more than that, beyond that, she's meant to be a companion. She's meant to be engaging and help people really engage with their health.
It's one thing to have a piece of equipment in your home in which you're instructed to interact with. It's another thing to have a friend with you. So what happens is there's a level of experiential engagement that's unmatched with what ECGs bring to the table with Addison Care. And now you're going to have a situation where not only are we doing medical management, vital signs capture, but we're also addressing issues around social isolation, loneliness, because you have Addison with you all the time.
We know that care costs as you grow older, and even just for chronic conditions that can be very stressful on people's lives. What we're hoping to do with Addison is kind of provide an alternative to some of the options they might be seeing otherwise. We want people to be able to follow their care plan, or, if something about their care plan isn't working for them, this is another way of flagging that. You sometimes don't get those, maybe it's a medication or maybe a scheduling type of issue. Sometimes you don't get those right the first time. And so I think Addison is a way to be able to give that visibility to people and to be able to make those adjustments in real time in a way that they probably wouldn't have been able to do without that software.
So the patient can interact with Addison through both voice and touch.
Thank you. Your temperature reading was 97.34 degrees Fahrenheit.
There's a module we designed called atmospheric mirroring with Addison. And on the base level, that's mirroring the time of day and weather conditions. So if it's raining where you're at, it'll rain in her house. If it's daytime where you're at, it's daytime in her house, so on and so forth. But to expand on that, you can also have her mimic your same beliefs and holidays and celebrations. So if you want her to celebrate Christmas with you, she can decorate her house during Christmas, Hanukkah, Ramadan. So initial launch will be just Addison, but quickly on the heels of that, you'll be able to start choosing from different avatars of different genders and ethnicities.
Tony, I'm so glad that you provided that video to see, so you could really kind of see what an avatar assistant, might look like and do. Maybe just with our last few minutes here, you could tell us a little bit about what you've learned from early interactions, with the assistant. We, of course, study consumer tech across a bunch of different verticals, and there's a mix of feelings that people have about unembodied voice assistants and privacy, and you're taking sort of a different approach.
Yeah.
So I'd love to understand a little bit better
Yeah.
what you're seeing in the interaction.
So it's tricky to get this right because people are very concerned about their privacy. It's one of the reasons that we didn't take the easy route of just opening up the voice to the cloud. We're doing our voice processing on the computing edge. And then in addition to that, we have got to pay attention to people's protected health information, obviously. And so we have layers of encryption, and we have facial recognition and other layered methods of verifying who's in front of the console asking the question before any of this information is given. So we've made it super secure. On the avatar piece, that was unique. What we wanted to do was, and this is through just almost an infinite amount of consumer and patient feedback, and doing a lot of focus group studies. If it looks too real, for instance, if I make it look like a Samsung 3D avatar that looks like an actor or a newscaster, that's invasive to people. They don't like that. They don't like things, and we've seen things on the market where somebody has like kind of the segmented, animated flat 2D chatbot, it looks like a cat or some character. They don't like that. They're almost offended by that. But there's this Disney Pixar sweet spot where you feel disarmed and at rest because it's obviously not real. And so that gives people a comfort. They don't feel observed by, a real person, which they would if it looked too real. But then it is so fascinating in that it is expressing humor and various forms of sentiment and empathy. And, Addison is calling out to you by your nickname. Phraseology is changing all the time. She's celebrating your matters of, preferred faith and holidays and your weather, and having this bonding experience with you. And what we found is that when you can bring this symphony of thousands of dependent components together just right, you can get it tuned for, human interaction at the level we have. Now what we're doing is we're going into studies because we're able to elicit responses, real emotional responses. People are laughing. People are walked through feeling calm when they're coping with distress or anxiety or coping with pain, chronic pain. We're able to calm. We're able to excite. We're able to humor. We, elicit these feelings of affection. And when you say, what is happening? We're impacting serotonin levels and dopamine levels and oxytocin levels. And we've seen these studies that, they do through social platforms, other types of technologies. We've tuned it for the process of enhanced digital care. And it's fascinating. I guess I didn't on this. When we put this out into live beta users, hundreds of these beta test users, as we started trying to call the units back, they said, what do I have to do? What do I have to pay? How do I keep it? And I think that was beyond the regular studies. People do not want to lose their Addison. We dropped a huge update on my mom, who was a tester. And when she couldn't interact with the objects and the creatures and the scenes for an hour, she had separation. She had separation anxiety. So where's my Addison, So the response has been really fantastic. And I'll tell you, we've got them out in some Medicare environments right now. And what we've been seeing on remote patient monitoring, because in Medicare, you've got to get a significant number of readings, right?
Yeah.
The requirement's like 16 days of readings. So what she's getting is 140% compliance, meaning she's meeting compliance and getting 40% more readings unassisted. That has been one of the biggest hurdles with remotely monitoring patients, is getting the use and the engagement. And we have finally got a solution out there that's a grand slam.
Well, Tony, thank you so much for sharing your insights today and telling us more about Addison, an electronic caregiver. I want to recognize that you jumped in here with a tough start to the session with some behind the scenes issues here. And I recognize that doing this from your location here is very difficult to do. So thank you so much for jumping in and being game and
Thank you.
flexible.
Appreciate it. Thank you. Appreciate it.
Yeah, we
Thank you
appreciate
very
your
much.
time. Thanks so much, Tony.
Okay, take care.
And so I'm very happy to actually launch right into our second panel of the session, where we are focusing on medical devices and expanded consumer health services. If you were here at the beginning of the session, you heard Kristen Hannick, our director of research covering the consumer health space, share some pretty compelling data from our consumer survey work about how we've got, I think, 54% of US households now having at least one connected health device. People are starting to consider whether or not a provider allows them to share their data when they're evaluating new providers to select. 47% of consumers in US internet households saying sharing connected health data during a telehealth visit is very important to them, and they'd really like that functionality. So we know that devices and sensors and collecting data in the home and tying that back into the healthcare ecosystem and really realizing the opportunity there is so important. So very excited to invite 6 industry leaders to flesh this out a little bit more. I'm going to ask each of you to come in and go ahead and introduce yourselves and your organizations in just about a minute, and then we'll dive right in. And I'm going to start with Mark. So Mark, if you could come on in, we're going to bring you in here. He's the CEO of Wellvy. Tell us a little bit more about Wellvy and about your role there.
Hi, Jennifer. Thank you for having me. I've been the chief tech. I was a founder of Wellvy, the CTO. I've recently become the CEO of Wellvy. We are a connected vital sign monitoring platform. We have devices and cloud connectivity to enable remote patient care. You see on the slide there, you see our device. Our main device is the multi-vital sign device. We have one device with 11 measurements in it, including clinically accurate blood pressure from the finger, which has been a very challenging vital sign to get. That's really enabled the compact form factor of our multi-vital sign device, which also includes heart rate, pulse ox, respiration rate, temperature, and some other vitals. We have a wearable and a weight scale. All this data is taken into the cloud, and the user is provided via an app with a dashboard for life. We have personalized trends and alerts. We also have the ability to manage your family's health, because not only do you want to really share the data with your provider, but you also want to share with other family members. And the administrator of the family has the ability to control that. We have a vitality measurement, which does the measurement of the blood flow in your finger. That has pre-diabetic implications as we see that vital sign change. And we have a first at-home stress test. And also we partner on the back end with Care Daily, which enables a lot of automation and AI in our platform. Looking forward to discussing more on the panel.
Okay, thank you so much. Thanks so much for being here, Mark. Okay, and next.
Good afternoon.
Great, thank you. We have Nick Knowlton, who's the Vice President of Strategic Initiatives at ResMed SaaS, Software as a Service, the software and services side of ResMed. Tell us a little bit about that part of the organization, Nick, and what you do there.
Great. Well, thank you so much. As you mentioned, we really have 2 major business units under the ResMed brand. We're probably best known for being an innovative designer and manufacturer of award-winning devices and cloud-based software solutions that connect to them. In the SaaS, or Software as a Service division, we focus on cloud-based software solutions for out-of-hospital care, probably most traditionally thought of as post-acute care. So the type of software that you find in skilled nursing facilities, in home health and hospice agencies, and home medical equipment providers. So we're a world-leading digital health company. We have tens of millions of 100% cloud-connected devices, tens of millions of patients in our AirView monitoring ecosystem, and more than 100 million patients in that out-of-hospital care network represented by the software solutions on the right. As you can probably tell from this, the topic today for the panel discussion is very near and dear to our heart, making sure that we are not only able to provide devices and software systems by which patients are cared for, but deliver actionable insights based on the data that can be collected into these platforms from the devices or from the caregivers directly. And as the prior keynote speaker said, this is about delivering more services to more patients, and I'd like to add, more efficiently to that. So the common thread that runs through all of this is care management in the home or wherever the patient or resident may live.
Wonderful, Nick. We're so happy to have you and to have your insight from the ResMed point of view. Next, I'm so pleased to invite in Dan McCaffrey, who's the Vice President of Digital Health and Software at Omron. Hi, Dan.
Hi, Jennifer. Thanks for having me. Excited to be a part of the panel today. To introduce Omron a little bit, Omron has a heritage of half a century in the heart health space, helping patients monitor their health mainly at home. We've got the #1 clinician and pharmacist recommended blood pressure device for several years now. We've been introducing new innovative connected heart health technologies that improve patient outcomes. And our main mission is going for zero. This is the elimination of heart attack and strokes. One of the main products that I oversee is called VitalSight. That's our remote patient monitoring platform that helps patients better communicate with their clinicians in terms of tracking their blood pressure and having the data sent directly to the clinics so that clinicians can better understand and manage their patients' hypertension.
Fantastic. Thanks so much for joining us, Dan. Next up, we have David Moss, who's the co-founder and CEO of CareDaily. Hi, David.
Hi, Jennifer. Hey, so CareDaily is the only white label home health AI and IoT software as a service solution that can actually deeply personalize health tech and age tech services for our branded partners. With funding from the National Institute on Aging, our award-winning AI caregiver software is the first to be scientifically validated to reduce anxiety and improve sleep quality in caregivers of people with dementia and Alzheimer's. And we do this because we make it feel like there's someone new on your team. Our AI caregiver is a software intelligence we call Artie, and our partners can brand it for themselves. Artie talks with people, it asks questions, it leverages medical and non-medical sensors to do amazing things. For example, Artie can detect falls in real time, it can learn lifestyle patterns, uncover hidden health problems, and we bring together best-in-class products and get them into the hands of branded distribution channels who can actually serve this up to millions of people. And today we're giving back to the age tech and health tech communities with an exciting program for approved medical and non-medical device manufacturing companies to leverage our award-winning home health cloud services to connect devices. This is unlimited devices, unlimited users, up to 10 million data points per month with no recurring costs. And we were very excited to announce our partnership earlier this month with Wellvy, and they're one of several manufacturers who have already shown interest in this program. So our home health AI software can not only add a lot more intelligence to these products and bring together ecosystems of devices, but we also help accelerate these manufacturers into larger distribution channels in the market. You can check out our website at caredaily.ai for more details. Thanks for having me today, Jennifer.
Great. Thanks so much, David. And really interesting to have both you and Mark here on the panel. And maybe we can hear a little bit later about, creating that partnership and why that partnership makes sense. I always feel like there's a lot of learning in how different organizations come together. So thanks so much.
Great.
Okay, great. So now I'm so pleased to welcome Brian Taylor, who's the Senior Director of Audiology with Signia. Hey, Brian, why don't you tell us a little bit about Signia and your role?
Yeah, sure. Thanks, Jennifer. Great to be with you. I am Brian Taylor, an audiologist, Senior Director of Audiology for Signia, which is one of the largest and leading hearing aid manufacturers in the world. I think when people think about hearing aids, they think about a large piece of plastic that's in or around somebody's ear that might whistle all the time. And today, I mean, that's really no longer true. Not only do hearing aids look like really cool consumer electronic gadgets, but they also do a lot of biomechanical tracking. They can detect falls. They can detect other bodily signs, heart rate, things like that. That can be really important to overall health. And why is that important? Because hearing loss is one of the most undertreated and inadequately treated conditions that adults face. 1 in 8 Americans have hearing loss, and oftentimes it flies under the radar. Of that group, only about 30% of that 1 of 8 actually wear hearing aids. And not only do hearing aids help people hear better day to day, but there's all kinds of emerging data that shows that hearing loss can slow down the effects of cognitive decline. Hearing aids can help a person lead an overall healthier, higher quality lifestyle. And in this era of healthy aging, having a device that not only helps you hear, but is connected to the world around you in some pretty astounding ways is really important. So happy to be with you and look forward to being on the panel.
Fantastic. Thank you so much. And finally, I'd love to introduce Brad Wiltz, who's the Director of Medical Business with A&D Medical. Hi, Brad.
Hey, Jennifer. Great to be with you. So as Jennifer was saying, I'm Brad Wiltz. I'm the business leader for A&D Medical here in the Americas. Just a little bit about A&D. We're the market leader in connected devices for blood pressure and weight scales. Been around in business for about 40 years. Our customer base spans anywhere from mass retail through the Veterans Administration. Work a lot putting programs together with different payers, providers, and very familiar with probably some of the attendees around remote patient monitoring and other health IT companies that have been speaking throughout the day. So I'm excited to be here.
Wonderful. So I'd love to jump right in here with our panel discussion. No time to waste. Love that we have a really full panel here today. And Brad, actually, I'm going to start with you and then maybe go to Nick. You know, some of the stats that Kristen shared, and we kind of all see it, there's this great big spike of virtual care, specifically on the services and sort of devices on the tail end of that during the pandemic, and settling back down now. And we're really in this kind of new reality of virtual care. So I'd love to, get your perspective of what the role of health devices and providing more care to the home is today. What are you seeing on the market?
Yeah, so I think devices itself, right, is an enabler. Over time, even COVID now has really accelerated the ability to put devices in a variety of patient populations. I mean, historically, it's been elderly chronic, and it should be, right? That's the right decision. But I think COVID has accelerated putting devices in just about every patient population, right? From peds all the way through any point of care. It's now available to measure in a variety of ways. 5 years ago, the questions we were asking were, fitness tracking, right? Will people do it? And now we're talking about, FDA regulated devices and how are they managing data? And that's exciting to see. But I think we've also now, fast forward the last couple of years, we're now what feels like a little bit of a race to say, how many measurements can you get on a single device? And it starts to feel, in my estimation, we start to move away from the patient experience, right? So if it's the apps, if it's the devices, it's the entire solution set. The main component that I like to think about when I look at devices and look at the activity in the market space is how are we measuring it against will patients use devices? Because if not, this is really a discussion on really expensive plastics, and that's not what the intent is. And so sometimes we look at things and it's like, are we better off doing 1 or 2 things really well, and then versus just capturing data for the sense of capturing data, and then it starts to get disregarded. And so I think this is a balance that we're really facing now as an industry, is to where patients' usability and utility is versus just capturing data because you can.
Yeah, absolutely. I imagine that some of the end users of your devices maybe even shifted and changed. Like you said, it was originally chronic and elder, and maybe there's a wider use of consumers who are end users that are actually using your devices today. Has that changed how you think about designing products, for that end user?
Absolutely. I mean, I think that's the ongoing thing. I mean, it's tough to say medical devices and the word sexy in the same sentence, right? It's probably the same conversation everybody on the panel has, right? Is what's the fine balance between making it look cool enough so people want to consume it, but you have enough utility in it to where they actually do it and have repeatability in the process.
Yep, absolutely. Now, Nick, I'd love to get your point of view on essentially kind of state of the market and where we're at. What's interesting is, ResMed has a reach not only into what we might traditionally think of as a home, but also home kind of care settings where it's not in his hospital, might be a long-term care facility where connected health devices are used possibly in a different way. So what are you seeing from the ResMed side?
Well, thank you. Great question. I really think that, building on what our keynote speaker had to say today, we're in an unprecedented period of clinician shortage. They're being asked to do more with less. There's more patients in the ecosystem. We have the silver tsunami still just, emerging on the horizon, and there's no end in sight for the clinician and other staff shortage faced in out of hospital care. So the rising importance here, can't be overstated. It really is about empowering those clinicians with, where do they need to reach out today? If you're a rounding physician in a skilled nursing facility, what are the patients in the population underneath your value-based reimbursement programs that could do with an intervention today, right? So being able to collect device level data on those patients, aggregate it, analyze it in a usable format, and deliver actionable insights to the clinicians and other care providers. With everybody being so busy in a shift change or, transitioning from one job to another in a clinical sense, it's very hard to keep track of patients' care evolution. So being able to look at simple things like, hey, our CHF patients, who has unexplained rapid weight gain? What other clinical signs are we seeing amongst these patient populations that will allow our clinicians to intervene with them? And as care shifts more and more to home due to patient preference and better ability to do these type of things, it's going to be of even greater importance. The only way that we can both simultaneously as a country take on reimbursement plans that involve managing risk at the provider organization level and provide a better experience for the patient and often for the family caregivers as well, is to deliver actionable insights to everybody involved and drive better communication. You think about the healthcare industry versus what patients who are also consumers were able to do during the pandemic in terms of interact on apps with Amazon and Shipt and everybody else. That type of consumerism demand is there. Now that they've experienced it in their everyday lives, they want to be able to do this in healthcare. They want to be able to connect that data and communicate about what it means with their care teams in real time.
Yeah, absolutely. And some of what you're talking about there is really the people. So I feel like the last panel we heard a whole lot about devices and data and maybe clinicians. There's a possibly, a staffing and a people element to this too, to getting the devices in the homes and set up right and used well. I believe ResMed and the Care Matrix or Brightree, part of your organization, also has some home hospice workers or workers that are actually going into the home. Are they taking more of a role in bringing the devices into the home, setting devices up, and supporting people in using, devices or applications or other virtual care tools?
Yes, so great question, especially within the Brightree family, where we're empowering HME providers with cloud-based solutions. During the pandemic, we saw a rapid increase in the use of remote digital tools to help patients answer questions. But you think about a discharge event from a hospital. one of the first, clinical folks that's going to see them in their home is that HME who is, dropping off an oxygen concentrator and, dropping off a wheelchair, right? So being able to do the right things for the patient in the home to get them set up and on the right path for care is very much, not just an existing trend, but also one where, the opportunities for early intervention with problems and making sure patients really understand how to use those devices is critical to long-term success. Therapy adoption of devices is the same thing as medication adherence. If you have a chronic condition and you use medical devices to help manage that chronic condition, it's just as important for that to be understood. We don't send people home with medication and no instructions for how they're supposed to take it, for instance.
Yeah, absolutely. That's a really good point. Now, I'd love to kind of talk about some specific use cases and how they're developing, right? So Dan, maybe if I can turn to you, you mentioned going for zero, talking about heart disease and stroke. Tell us a little bit about, I think the Going for Zero campaign kicked off a year or two ago. How many years are we in now? I remember
correct.
CES. Yeah. So how is that developing? What outcomes are you seeing? And maybe, what sort of innovation are you seeing to really move that part of the, that use case?
Yeah, I love targeting the discussion around use cases because I think that really drills into where the value is being created and how the value is being captured for the different stakeholder within the healthcare ecosystem. What we're seeing at Omron is that clinicians want a solution that is easy to use, helps a large segment of their patient population, and reduces the clinical overhead or friction. So the CDC has reported that roughly half of the Americans of adult age are suffering from hypertension, 47%, 116 million people. And so the clinicians and the hospitals that we work with really want us to address the single need of monitoring their patients at home. So for decades, patients have been taking notebooks, they've been taking their devices into the clinics, which is hard for me to imagine in 2023, but it's still happening today. And so the best use case that we've been solving for, and we've seen a ton of traction, is taking blood pressure data from the home, using the hub and the Vital Site kit to then send that data into the clinic so that clinicians can better titrate medications. They can better understand and improve medication adherence and compliance. And so from our side, the simplicity of hypertension monitoring and taking the data from the home and putting it directly in the clinician's hands has seen a major improvement in both clinical outcomes and economic outcomes.
Are you seeing a difference or a shift at all in how devices are getting deployed? So for instance, a blood pressure cuff, I can buy at CVS or Walgreens myself, or it can be provisioned as part of a chronic care management program. Are you seeing a shift in your portfolio or how that demand is coming through? And then that kind of has implications for how it all gets linked back together, right?
Yeah, absolutely. The clinicians have asked us to do all of the heavy lifting for the patient. So in the Vital Site program, we ship the patients a kit, and the devices are already configured and ready to be used out of the box. And so there's very little upfront friction. Patients have gotten used to the Amazon or the Uber user experience where things show up, they work, and there's not a lot of cognitive load on creating an account or integrating my devices. And so what we've seen is this really enables engagement from the out-of-box experience and then supports a more compliant patient over the weeks and months. And so to answer your question, the changes I've seen today from where we were a few years ago is that everything has to be ready for the patient to use right out of the box.
Okay, awesome. So I want to go to David and then Brian here on use cases too. So David, I know that you all have a strength specifically in seniors, but also as a platform, maybe see a variety of different use cases. Different manufacturers trying different use cases on your platform. Can you talk about kind of the evolution of the applications that you're really serving today?
Sure. Yeah. So when we think about devices getting connected to the internet, to us, this becomes part of a body of this artificial intelligence that should make sense of all this data. I think that there's a common application here, which is to not just consume the data from devices and understand that continuously, but then to talk to people about it and to engage people. At the end of the day, all of these devices are just a way to keep an eye on things 24/7 so that we can take a mental step back and realize that everything's okay. So we're helping caregivers, both family and professional caregivers, provide 24/7 continuous monitoring in a living space. And it's important to start kind of on the private end of this spectrum. From a spectrum to private to invasive. If you're dealing with, especially younger populations who don't think of themselves as old, they're not going to appreciate cameras and things in their living spaces. So instead, we have to look to other types of sensors. Biometric sensors are great. Sometimes you can only get periodic lower resolution readings off of that. A higher step up would be to look at lifestyle patterns in the space. You can do that with things like LiDAR, passive infrared motion sensors, other activity sensors in the space. Even Wi-Fi motion sensing is starting to hit the scene. So all of this data is flowing in. And what's important from our perspective at a software level is to really make sense of that data and to be able to talk about it as if it's one caregiver speaking to another, to summarize the insights, to elevate the people who we really need to focus on today so that we can improve our staff utilization and really deliver peace of mind to these family and professional caregivers who deserve it.
So is there a piece there maybe you want to talk about with the partnership with Wellvy, and then after we get to Brian, Mark, I'll come to you too a little bit, and what that partnership means for, or especially for the seniors, the family caregivers, right? What is the actual outcome to the people who might be using the technology?
Sure. So today, our AI caregivers can really start small by talking with people, by asking questions, and then you might level up. So as Dan was talking about this sort of out-of-box experience, I think that we need to educate consumers in general about this opportunity to work your way up the stack. So getting into the wearable zone, Apple Watch is a nice one, but Wellvy actually has a nice wearable hitting the scene here, and a number of other devices that complement the solutions that Care Daily has been providing today. And where we have had some strengths in the past is to have continuous monitoring over a living space with very few sensors. So where Wellvy and Care Daily and that partnership really shines is the ability to now access lots more data from the person's body in addition to the lifestyle patterns that we're capturing in the home. And we end up with a total 360-degree understanding of how people are really doing.
Okay, fantastic. Thanks for clarifying that. And Mark, I'll get to you in a second. But Brian, I wanted to, on this use cases conversation, make sure that we talk about audiology and hearing a little bit more. In your introduction, you really made a great point that it's something that is overlooked and probably a lot of people just sort of deal with or think of as maybe normal aging. But it's a real quality of life issue. And we know, from our own research and other, great organizations like AARP out there, that isolation is a huge problem for seniors. And so if you're not able to hear well, you might also be disengaging, from others as well. So a really big problem. So tell us a little bit more about how hearing is getting smarter, right? And how, maybe the stigma, if it will, of wearing a hearing aid might be changing. We see this a lot in the PERS space. Nobody wants to wear a medical alert button and signal that they might be unwell, right? I think maybe the perceptions of hearing aids are changing too.
Yeah, I would say that probably the best thing that's happened to the hearing device industry over the last 5 years is the introduction of the AirPod from Apple, because now everybody is wearing something in their ear. So to a large extent, that's taken away stigma. But at the same time, I think what's really interesting about my industry is that you're sort of seeing the melding of the traditional hearing aid, medical device, lots of programmability, distributed, sold by licensed professionals, where you had to make several appointments to buy it and get it programmed and fine-tuned. That kind of that specialty is now kind of melding with consumer electronic devices that fit in the ear. And so what you're seeing happening are these devices that are self-fitting, that people can basically with their smartphone program, fit, fine-tune the devices themselves. In addition to that, they're getting a whole lot smarter, and they can track your movement, so they know if your activity levels are being boosted because you're hearing better. And there's data to suggest if you hear better, if you're more active and you're hearing better, your lifestyle, your quality of life improves. You can track if you're vocalizing or talking. So a provider that fit the hearing aid can look and see, now that you're wearing your hearing aids, I can see that you're talking a whole lot more. You're a lot more socially engaged, and you can kind of see how there's this virtuous cycle of better data equals better performance from the hearing aids, and better performance from the hearing aids, I think, yields better patient engagement. And that all, I think, stems from, devices that look more like consumer electronic gadgets, and devices that are easier to fit, more intuitive to operate, don't require a lot of follow-up visits with a medical provider, audiologist. And, that virtuous cycle, I think, continues to help patients expand the market, help people hear, help them communicate, boost their quality of life. So a lot of positive developments in my industry.
Yeah. Do you see sort of the smarter next generation hearing aid, because you can sense motion and movement being part of a larger kit or package of devices? First, obviously, for patients who would need that as a component, where that is giving that activity of daily living a look, or is it more, let's develop a great product for this patients that, that have these needs, right?
Yeah, it's really hard to know. I think one of the really interesting things that's happened in the hearing aid device industry is consumers, as of October of last year, can buy devices over the counter. And the idea there is that will stem competition, and you're going to see, I think, some new companies come to the market with some really cool devices that maybe do some of the things that you just described. It's really hard to know. We're in the very early stages, but talk to me in 3 to 5 years, and I'm sure you'll start to see some things that are incorporating some of these other kinds of metrics into them.
Yeah, absolutely. So Mark, I want to make sure I pull you in here. Especially, can you talk a little bit about the data that you're collecting and the purpose of that data, right? So someone mentioned in one of the earlier panels, are we trying to stuff a whole bunch of vital signs, and detect everything we need to detect, collect just one type of vital sign? I think you all are actually maybe working on your own type of insight or score or measurement that communicates a specific thing. Maybe tell us a little bit about that and why you took that approach.
Yeah, it's Jennifer, our philosophy at Wellvy was to measure as many vital signs as we can with clinical accuracy. Okay. So take a wearable, for example. There's some very attractive wearables out there. There are some very functional wearables. But if the data that you're not receiving from the wearable is clinically relevant and clinically validated, it actually, first of all, legally for the FDA has very limited use, and also medically has very limited use because doctors can't rely on the accuracy of it. So at Wellvy, we have intended to get as many parameters, almost like a tricorder, if you happen to be a Star Trek fan, as many clinical grade vital sign parameters from your finger, and of course we have temperature from the forehead, as possible, and get that into the cloud. Because what we can learn from that is you can provide an overall assessment of someone's health, because symptoms vary between people. In the case of hypertension, okay, obviously is blood pressure. But in the case of COVID, for example, so in some of the pilots we've done with COVID, looking at how COVID affects different people different ways. It has bigger effects on certain people's blood pressure, affects people's SpO2 more. And how are we to know which one it will affect? Well, that's why you need to measure as many as possible. and then be able to take that data and get it into the cloud as quickly as possible, which currently we're via BLE via our app, but all our next generation devices will be cellular. Because to force someone to have to, to either pre-configure a connectivity between the device and the app, or to force someone to have to do that if it's an over-the-counter device, is actually very challenging for the elderly. It's very, very significant feedback we've gotten from our hospitals that say, look, we need to see cellular in all the next generation, because the faster that data gets to the cloud, the faster it can be acted on with analytics tools like that we use in the Care Daily platform. So you don't know, we don't know the relationship, and we don't know everything we need to know about the human body. And that's one of our quests as a society, to learn more. And that's why most of us are in healthcare. But the reality is, the more clinically relevant data you can get, the more you can do machine learning and AI on that data to really help get into predictive analytics, right? To actually start to figure out what direction your health is going in. And, we actually take so many vital signs with our device that even for a person like me who's very familiar with the meaning of the vital signs, you need to help people interpret them. And so we have a scoring system that takes your vital signs. It calculates your score, your balance score. That's your score in the morning and the evening when you're at rest. Calculate your stress score during the day, your vitality, what's your potential, for activity. You need to help this to engage people. In addition to, avatars and some of the very, very cool patient engagement tools we've seen. If you can gamify health, you're going to get people engaged in it, right? If you can say, look, hey, your score is going in this direction, you might want to think of this. That's very, very powerful. And that's really what we see as the power of our platform, is to assess the person's health in total and then gamify it and give them a sign of what direction they're going in. In addition to, the wearable, which gives you activity and stress, because, there's a clinical aspect to vital signs. There's how active you are. That could be moods and depression. And then, of course, there's weight. And we really see that, all that data together is an overall assessment of your health. And that's really what's, the most important.
Yeah, you're talking about a couple of different things, but really also around, engagement. And Tony made a good point that, especially from the clinician side, you think about care compliance and compliance with your plan. It used to be focused just on medication compliance. Well, you might have an app or a device. Are you compliant with that device? And oftentimes it's not that people are intentionally not complying. It's that they're not able to, or the instructions aren't clear. So that first layer of connectivity that you're talking about is really important. And so for certain devices and for certain use cases, Wi-Fi, Bluetooth connectivity is perfectly fine. And then there's on the medical side, if you're in an ongoing program, the ability to have a cellular built-in or connected hub is really important. But then also this idea of gamification, or what makes people want to engage, is really interesting. One question I had for you was, I see that you all have also done some, you're creating your own scores, but then doing also some academic or clinical research around that. I think your team shared some documentation of that is up on for the attendees here. It's up on our attendee website. So thanks for sharing that, because I was reading about it before the panel. So tell us a little bit about why you took the time to do some of that research, and what you learned.
Yeah, so we have a partnership with Mass General Hospital, Partners Healthcare, to validate the wellness application of the device. There's always a challenge. I can't remember who exactly mentioned it, but they put it well. We always want the devices to be as attractive as they can, right? And as compact and as portable as they can. And we are miniaturizing our devices. That's obviously a very important next step. But, to work with, a group like Partners to understand that, hey, people can use this. You can get clinically relevant information. And, things will get smaller over time, but there's a certain finite size you need to measure, for example, blood pressure from the finger, or SpO2 from the finger clip. If you make it too small, you all start letting light in, the accuracy goes down. So to really validate that people can use this and get, accurate measurements, with a group like Mass General, and that it is valuable for monitoring people at home, was very powerful. And we've put, wearables and weight scales do give you valuable information. Don't get me wrong, but Wellbe, we have a clinical backbone. We will not sacrifice the accuracy of our device for a more attractive compact form factor, because the value of that data, it just doesn't help you care for the person. And it doesn't, in fact, there's quite a bit of a danger over devices that, are pure wellness, and there has to be care taken that people don't misinterpret and think that they're healthier than they are. But, to validate not only the vital signs, but the scoring, the usability of it, to make sure that people can use it. Because, a number of people have touched on the fact that if it's not usable, then first step is getting them to use it.
Yep. So I want to go into kind of new form factors and different types of sensors and their value, but I just want to make a call to the attendees. I love to take questions. So if you have questions, you can put them into the chat or the question tab, and our staff will see that and we'll bring those in. So we have about 15 minutes left. So I just want to make sure that if you have a question that you're getting those in. So maybe I'll go to David and then Brian and maybe Mark if you have a perspective on this too. But are there interesting form factors that you're seeing that are collecting new types of data? We see a lot on the ambient and passive data sensing, especially to get those nighttime vital signs. When we think about a wearable, like a watch, especially in older populations, might not be comfortable to wear all the time. They might not want to wear something when they're sleeping, or the idea of disposable sensors, right? That they're just sensors have gotten so cheap that they can just be patches and you throw them off. What are you seeing that is particularly interesting in the evolution and innovation in sensor tech?
Sure. So first off, I love what Mark's doing, because once we have a single sensor that can capture a whole bunch of stuff, that's what our machine learning algorithms are interested in. We can start to find trends that may uncover some hidden health problems. There are other types of ambient or passive sensors hitting the scene as well, in addition to things like Wi-Fi motion sensing, which would typically require you to have a new type of gateway or hub put in your home. There's promise around radar devices and LiDAR devices. I've seen some really cool stuff about, for example, having a radar device near the bedside sensing your breathing and heart rate where there's nothing even hooked up. And then also things like, for example, there's a company called Butler, which has a sort of a temperature pixelated map of the room that's understanding lifestyle patterns in that room. Vyar Care with radar, understanding if there's falls in real time and more. So I think that there's a lot of opportunity here, but one thing that's important is to keep the cost low. So with our AI and machine learning services, the objective is to actually use very sparse data and to get a good picture of what's happening in this person's life. So we're able to actually reduce the number of sensors in the home and fill in the gaps with machine learning services so that we can really have cost-effective solutions. Finally, when it comes to engagement, we are engaging with people. Our AI caregiver already actually talks with people. And today we've actually integrated with tools like ChatGPT, which is improving engagement. We have shown that we can actually influence the behaviors of large populations of people just by challenging them, just by gamifying it, just like Mark was saying, and getting people to change their behaviors in a way that improves their health.
Interesting. ChatGPT is in everything now. Interesting to see how that tech evolves. But I think it is a good point too. Of course, I mentioned, sensors getting cheaper, but they do still have a cost. And there's a question depending on your house layout and what type of, home you live in, how much of the living space you need to is worthwhile covering for, different patient populations. So sometimes, the most common falls are around the bathroom or in the bedroom, but, is it going to be different for different people? And that's kind of a open maybe question to everybody. If anybody has a point of view on how you think about sensors across a home landscape. Sounds like, David, you're doing more with less.
Yeah, well, what's interesting is the kitchen. So when we're looking at lifestyle patterns in a living space, the kitchen is where to go, because everyone's going to the kitchen before they go to bed, when they wake up, when they come home. You get a lot of great data. Even from a single sensor in the kitchen, I can predict accurately what time you're going to go to bed tonight, what time you'll wake up in the morning. And that's all through machine learning services. Hallways and stairwells are the next place to instrument. A place you spend time, if we want to make sure we're doing fall detection, that's important. And then if you have a sensor in the bedroom, it's sleep quality. In the bathroom, it's bathroom visits. that gives you a nice picture of what's happening in this space. And then I'll reemphasize, if you want to really know how someone's doing, why not just ask them? We don't always need sensors. So a great place to start is by engaging with people conversationally, identifying the problems, and then constructing a world in which we can have continuous monitoring through more premium sensors.
Mm-hmm. Just to stay on this point here, maybe Nick, I don't know if there's anything that you have to share, especially with the long-term care communities and those where it might not be a single-family home type layout, right? And there might be multiple residents that may or may not have some form of monitoring. Is that ambient and passive sensing becoming more common, or what are you seeing?
Yep. Yeah, I definitely believe it is. We actually incubate a number of approaches in-house for doing passive sensing in a patient's home or in a caregiving facility. But in addition to the work that we're doing on that front, we also have a very active partnership ecosystem. We're seeing tremendous amounts of traction, not just in terms of organizations reaching out, wanting to plug into, say, for instance, in a care facility, patient monitoring devices, be they passive or in some cases even wearable devices. But there's a lot of experimentation going on. There's a lot of very exciting small companies that are becoming much more prevalent in this space. And we're also seeing on the flip side of that, more organizations getting involved in analyzing that type of data to deliver insights to the care providers that are responsible for keeping them healthy. In that department, we also have several initiatives. We have active analytics running for predicting fall risk, which of course is a tremendous concern in any caregiving facility. So I'd still say that it's early days on both fronts, both in terms of the devices and then in terms of what we can do with the data. But I do believe that in terms of the evolution of care being driven here, we're going to see tremendous advancements in the next 24 to 36 months. And then last but not least, connecting that type of data better with patients. I know that you had some questions around, consumers understanding the data. I think it's our responsibility in the tech industry to make sure that what we deliver to them and to caregivers is not information overload. It has to be made useful. We all know alert fatigue is a very real thing, and it's not just clinicians who get it. It's also patients. If you consistently flag for them that something's off and it's not, then they're going to quit using it. So I think that's one of the key areas. We do also see very rapid advancement within our partnership ecosystems for creative ways to engage, both patients and their family caregivers. As we think about the growth of the sandwich generation and how much individuals are now trying to do while they balance their careers and care for their children and care for their elderly parents, the ability to interact with those insights, the ability to drive team conversations with what can often be very complex care teams, to get concerns answered. That averts ER visits, it averts bad days for patients, it averts costs for the healthcare ecosystem.
All things we're looking to drive for sure. David, you got a question immediately about how can ChatGPT and generative AI impact usability?
Sure.
So,
Well, it's
yeah,
exactly what Nick
that.
was saying. How do you make all this information usable for people? What's really cool is we've got, using tools like ChatGPT, we were already describing, as if it's one caregiver talking to another, what's happening in a person's life. And now we can have a conversation about it. So you take that information, you get that into the hands of ChatGPT, which can actually make sense of it, and you can have a conversation, talk back and forth. And the sentences that are produced are a lot more smoother and professional, so we can actually really talk with people. And I think at the end of the day, as we're bringing people together and adding a new person to their team, this AI caregiver, again, ours is called Artie, our partners call it whatever they want. And it's like you have a new person there who's really part of your team, helping to describe to you the problems and being there watching over your loved ones 24/7.
Awesome. Thanks for taking that. So I know we only have a few minutes left in our panel, so I do want to take an outlook for the year. It's January. Everybody's thinking about their strategic planning for the year and how this year is going to go. I'd actually like to, we've been talking pretty all this great innovation that's coming down the pipe. So I want to take a step back and talk about some of the challenges right ahead of us. Brad, and maybe I'll start with you here and then go to Dan. Can you tell us a little bit about, what challenges are facing the connected health market today? Are there specific things that, your organization's tackling this year?
Yeah, I think just a general sense of it, right? Whether it's an integration to an EMR, you look at data integrity, or even us as vendors, right? There's a lot of confusion in the marketplace right now. And I think it's both at the consumer level and also at a B2B level with health professionals. If you took 3 years ago, you'd walk into any retail store and look at the diagnostic category, they might have 8 offerings. Now everyone has more than 20, right? So even at a consumer level, they're not sure what they're supposed to use, why they're using it. And then you look at the provider level, I feel for them in a lot of ways, right? They're trying to sift through a lot of noise, a lot of, in some ways, we're guilty of it as well, like marketing buzzwords to really, understand and try to, look at where we can gain traction and versus things that are in the market that are happening. I look at, the rest of the panel, it has all great offerings, but in some ways the community hasn't done enough to really differentiate, what, and I like to call it like digital theory, right? Things that we're investing in that could happen versus things that are really practical application that are driving outcomes. And I think as we, transition throughout the year, I think that's going to start to cement itself because we're seeing it now just in investment, right? That's starting to tailor off in terms of, what's the valuation of something, 50 times that it was 2 years ago. And now you're seeing dollars more into, real application and practical management of patients. And I think that's where we as an industry will start to improve upon and really start to identify and almost codify folks that are sort of doing it versus others that are doing it really well.
Yeah. And some of that sense of, okay, now the proof is in the pudding, right? There's this great funding that has come into the market and this great advancement, and now a little bit of making it real coalesces with a little bit of the vibe of one of these questions that we got, which is these devices collecting data is great and really useful, but can it ever really fully replace an in-person visit with a clinician? And I think, I don't want to speak for anybody, but it might be, these are complementary, not necessarily, a replacement, but there are programs like Hospital at Home, where it's really, you're trying to take acute level care and bringing it into the home, though there's staffing there too. Brad, I don't know if you wanted to respond to that kind of sense of reality. What's the reality here?
This is my opinion. I don't think it's ever going to replace it, a visit, right? There's things that just you do at a doctor's visit. Do I think it's a great setup to having a better visit? Yes. Do I think the more information you can gather prior there, right? So if it's a baseline, I think, David, you mentioned it, right? A 24-hour clock, right? Take that whole pie and you look at someone's resting heart rate, you combine it with someone else's solution, and now you have a baseline when they're resting versus when they're sitting on the couch, right? Those are 2 different data points. That doesn't lie when you're in front of the doctor, right? So like that's the part when you're always feeling well, but the data always says something different. And so I think there's a way to move all this in a way, together. And that's what, I think that's what's exciting still, right? Is all these things to start to coalesce, and the doctor's still the epicenter, right? They're still the ones that have to analyze and do all these things. All the algorithms still make it easier, but at some point the doctor still has to say yes or no to this is what we think it is.
So Dan, maybe last thoughts to you here on the challenges in front of the connected health market this year. What are we going to be focused on solving this year?
Well, hopefully we're focused on codifying connected health's place in the U.S. healthcare system, right? We've been through 2 or 3 years of the pandemic that enabled us to really examine the value of these technologies. And so I hope that we move to a place where remote patient monitoring, remote therapeutic monitoring, software as a medical device is officially codified into the U.S. healthcare system in a way that clinicians understand what they're getting when they sign on for a program. Patients understand who's paying for it and what they need to do to be reimbursed. And there's an increased collaboration from the payers, the clinicians, and the technology companies following what was a once in a lifetime opportunity to really pull through the value of these connected care technologies from the lab or from the research center directly into patients' home in a way we've never seen before. So I'm hoping that the U.S. healthcare system as a whole can codify some of these technologies into the system so that we can all move forward together.
Fantastic. Great word to end on. Dan, Brad, Brian, Nick, Mark, and David, thank you so much for your time today and sharing your great insights. We really appreciate you helping us kick off our first Connected Health session of the year. Thanks so much.
Thank you.
Thank you.
Thank you.
Have a great day.
Take care.
Take care. And so for everybody who is attending, thank you so much. Thanks for your questions and for participating in the polling questions earlier. We welcome you to come back on March 30th, which is our next virtual care session focused on current and future demand. We are looking forward to seeing you there. Also, we have 3 different studies related to connected health that are available and are new and ready to publish or ready to be purchased. We have an industry report that my colleague Kristen Hannock authored on the connected health at home state of the market, as well as 2 different consumer survey points of view, really bringing the consumer end user view into this, and actually on the senior side, also family caregivers. So talking to seniors, talking to family caregivers, and then talking to consumers generally about their use of telehealth and remote patient monitoring. So let us know if you're interested in any of those studies. And thank you so much. We'll see you next time.